slide summarizes the nutrients identified in the literature that alter gene expression when a woman has SNPs on CYP1B1, COMT, and MNSOD. I'll be giving you a case history shortly showing how a urine estrogen metabolite test assesses the efficacy of a nutrigenomic intervention, or whether you need to tweak the dose of a supplement to achieve the desired outcome. In the case of this woman, she was given both Dimpro Plus and EPA-DHA. The nutrigenomic mode of action is to upregulate the expression of CYP1A1 to reroute estrone away from 4-hydroxyestrone and more to the 2-hydroxyestrone bucket, if you will. S-adenosylmethionine, or SAMe, acts as a catalyst to help COMT methylate 2-hydroxy and 4-hydroxyestrone. As a rule of thumb, antioxidants are increased in a woman with a SNP on MNSOD to help neutralize the free radicals generated by 3,4-estrone-quinone. When a woman presents with this particular SNP profile, CYP1B1, COMT, and MNSOD, we also recommend lifestyle interventions, namely to avoid excess alcohol intake, reduce stress, and practice stress management techniques. Why? COMT also degrades catecholamines, L-dopa, epinephrine, and norepinephrine. A SNP on the gene is associated with late-onset adult alcoholism, anxiety, hypervigilance, and other emotional disorders. SAMe supplementation can facilitate catecholamine degradation and lead to a less stressful circumstance or situation. A few words about bioresponse DIM before I move on to the case history. DIM stands for diindole methane and is a derivative of indole 3-carbinol, a constituent found in cruciferous vegetables. Not only has it been found to reduce estrogen receptor activity, but it also has benefit for those wanting to boost BRCA1 messenger RNA expression for those women with the inherited form of breast cancer, and those women wanting to prevent ER-positive breast cancer or its recurrence. Bioresponse DIM upregulates cytochrome P450 1A1 gene expression, rerouting estrone away from the 4-hydroxyestrone. There are many DIM products on the market. For better absorption, insist on the bioresponse form of the supplement. It is wrapped in lecithin to improve its absorption. We already know that antioxidants are necessary to neutralize and sequester free radicals. But it's good to remember that the antioxidants like vitamin A, vitamin C, and vitamin E are part of an antioxidant cascade, and by working together, they take reactive oxygen species and convert them into water. It's also important to remember that each one of these antioxidants needs to be present in the right amount at the right time in order for this antioxidant cascade to work effectively. The woman I'm about to describe in this case history has been cancer-free for the past 7 years following the nutrigenomics recommendations and strategies from the estrogen gene test. The estrogen gene test is part of TQM's FEM panel and evaluates the genes that Cerny and others have identified which can contribute to ER-positive breast cancer in postmenopausal women, namely CYP1A1, 1B1, 3A4, COMT, GST, M1, P1, T1, and MNSOD. I've been working with the estrogen gene test for more than 13 years, having an ongoing study with more than 175 women, results of which I'll share with you in a few minutes. As you can see, when this woman sought my counsel, she was postmenopausal, had a 10-year history of HRT, was diagnosed with ER-positive breast cancer in 2007, and had a mastectomy of her right breast. She was worried, as most women are, about the possibility of recurrence, so I suggested doing the estrogen gene test. Her results are listed here on this slide. She had a SNP on CYP1B1, which means that she preferentially routed estrone to the 4-hydroxyestrone molecule. Remember, this is a bad guy. She was homozygous for COMT, meaning that she poorly methylated 2-hydroxy and 4-hydroxyestrone, and GST M1 was absent. GST-M1 is part of a cluster of glutathione S transferase genes that convert 3,4-estrone quinone into glutathione conjugates, such as mercapturate. Her risk of ER-positive breast cancer with this SNP combination, namely CYP1B1, COMT, and GST-M1, according to Cerna's research, is approximately 2.7. She was started on Bioresponse DIMPRO Plus, and a concentrated form of fish oils, which provided 1,000 milligrams total of EPA-DHA in a 2-to-1 ratio in each capsule to upregulate gene expression of CYP1A1. She was also supplemented with SAMe to facilitate more methylation of 2-hydroxy and 4-hydroxyestrone molecules, and 5 important antioxidants: N-acetylcysteine, a precursor to glutathione; selenomethionine, a cofactor necessary for the generation and regeneration of glutathione; vitamin C, beta-carotene, and mixed tocopherols, which are first-step antioxidants in the antioxidant cascade, were also supplemented. As a researcher, I'm always interested in knowing whether something I'm recommending clinically is having a desired benefit in the patient's physiology or biochemistry. When assessing the nutrigenomic interventions as part of the estrogen gene test, I use an urinary estrogen metabolite test, which are available through several labs in the U.S. and, from what I understand from Dr. Esquivel, will soon be available here in Mexico through TQ Medicine. I'm sure he will give you periodic progress reports and let you know when that test has been validated and available for purchase. The test measures the primary estrogen metabolites, estradiol, estrone, and estriol, first-tier estrogen metabolites, 2-hydroxy, 4-hydroxy, and 16-alpha-hydroxyestrone, and most importantly the second-tier metabolites, the 2-methoxyestrone and the 4-methoxyestrone. This was my patient's urinary estrogen metabolite test prior to the nutrigenomic intervention. Notice her 2-hydroxyestrone and 4-methoxyestrone levels were on the low side of the reference range. However, as you might expect for a woman with a SNP on CYP1B1, her 4-hydroxyestrone levels were way outside the reference range. On the other hand, her 4-methoxyestrone level was not detectable. For those who have used traditionally the ratio between 2-hydroxy and 16-alpha-hydroxyestrone to determine a woman's risk for breast cancer, you can see that her risk is very high. You might expect, because her 4-methoxyestrone level was not detectable, her 4-methoxyestrone to 4-hydroxyestrone level was also not detectable. After 180 days of nutrigenomic recommendations I just shared with you, her urinary estrogen metabolite results were radically different. Notice all her metabolites were in the reference range, including 4-hydroxyestrone, 4-methoxyestrone, the ratio between 2-hydroxy and 16-alpha-hydroxyestrone, and the ratio between 4-methoxyestrone and 4-hydroxyestrone. These results suggest that 1. Nutrigenomic strategies based on a patient's DNA can improve a patient's urinary estrogen metabolites. Number 2, minimize her risk for ER-positive breast cancer recurrence. And 3, give her a psychological boost by following a personalized protocol to beat the odds of breast cancer recurrence. This translates into better patient outcomes, in my opinion. I want to make it perfectly clear that we are not recommending a woman diagnosed with ER-positive breast cancer forego any conventional treatments like radiation, chemo, and if necessary surgery recommended by her oncologist. We are advocating that all women take the estrogen gene test, however. The results will help the healthcare professional determine if a woman needs nutrigenomic support to mitigate her risk of ER-positive breast cancer or its recurrence, brought about by a woman's inability to effectively detoxify estradiol or its cancer-causing metabolites. As I mentioned earlier, I have a 10-year study consisting of more than 175 women who have SNPs on at least 3 of the following genes: CYP1B1, COMT, GST-M1, P1, T1, and MNSOD. Nutrigenomic interventions have improved estrogen metabolite balance, and we have not observed any incidence of ER-positive breast cancer or its recurrence in this study population. Here is a treatment strategy I use for an ER-positive breast cancer patient. First, I review the patient's history of estrogen exposure, HRT, IVF, birth control. I have every woman do the estrogen gene test. You can order it through TQ Medicine and Dr. Esquivel's office. When you get the results, interpret them correctly. I only used one example in this presentation this evening, but I have literally done hundreds and have seen every different type of SNP combination. Dr. Esquivel knows that he can call me for my interpretation of a patient's results, and I will give him my nutrigenomic recommendations, suggestions, thoughts, and ideas based on my 14 years of genomic testing. As part of best practices, I am recommending an estrogen metabolite biomarker test to assess the effectiveness of a nutrigenomic intervention. I believe this test is under development here in Mexico, and from what I understand, will be available soon. The medical paradigm of one size fits all no longer applies in the era of personalized medicine based on genomic testing and nutrigenomic strategies. We have demonstrated that it can improve biomarkers, prevent ER-positive breast cancer or its recurrence in a sizable population of premenopausal and postmenopausal women, and psychologically it gives women an edge, knowing that she is personally taking responsibility for her health and well-being. Thank you for your time and attention this evening. I will entertain any questions you have at this time.